All students are required to have GW's GeoBlue International Health Insurance Policy when traveling abroad on GW-affiliated travel. Students will be automatically enrolled by the Office of Study Abroad after committing to their program. Enrollment does not require any action on the student's part other than committing, which involves completing all required materials in GW Passport. Once committed, our risk management team will begin the process of enrolling students, which will be done in the order of departure date and may take time as it is a manual process to complete. Once enrolled, students will receive a welcome email from GeoBlue to prompt them to make an account to access GeoBlue resources. We recommend you to read the emails carefully and explore GeoBlue's website carefully to understand your coverage plan. It is also helpful to download the GeoBlue app on your phone so you can access medical resources easily. GeoBlue coverage is included in students' tier fee for every program and cannot be waived, even if you are already enrolled in international health insurance and even if your program offers additional insurance. It's essential that all of our students are covered under the same plan, especially in case of emergency. As a result, some students may be doubly insured, and that is okay. We simply encourage you to fully understand the coverage of both plans to determine when it would be best to use which plan and under what circumstances. GeoBlue is not the same thing as the GW Student Health Insurance Plan, known as SHIP, which is domestic coverage. If you happen to see a separate health insurance charge on your GW e-bill during your study abroad semester, this is not GeoBlue. This is SHIP, which can be waived by contacting the Colonial Health Center. We encourage students to be mindful of any possible gaps in coverage when deciding whether or not to waive SHIP. It is worth noting that GeoBlue is health insurance, which is not the same thing as travel insurance. Travel insurance is meant to safeguard your finances and belongings in the event of disrupted travel. This is not provided by GW, but it is something we strongly encourage purchasing. With that said, we pass the floor to our wonderful colleague at GeoBlue to share more about their coverage, services, and resources.
Okay. All right, so I'm going to let Alyssa go over the first couple of slides, and then I'll join in with some further information.
Thanks, Allison. So this is just a brief agenda of what we're going to cover in this session. So we're going to briefly go over the study abroad coverage that GW has in place with GeoBlue. We're going to review the GeoBlue mobile app and how you will be able to download and register for that on your phones. Then we're also going to touch on two newer features that we've added for telehealth, so telemedicine as well as telecounseling. And then we will touch on our global health and safety team and those services that they provide, which is basically the medical assistance department at GeoBlue that will be helping you should you require any assistance while you are abroad. And then finally, we'll just give a few tips and information in regards to the HIPAA process with GeoBlue. Okay, so this is just a very high-level overview of the study abroad coverage and benefit levels that you will have while you are on the GW program. So the plan does not have a deductible, so there would not be any type of out-of-pocket cost that you would have to pay for a deductible, and services are then covered at 100%. And this is really important for a plan when you're outside of the US because most international providers don't know how to apply and administer plans with deductibles and coinsurance because it's not kind of normal to their healthcare systems and insurance plans. So when there's 100% coverage, international providers are likelier to want to work with GeoBlue and to bill us directly so that there's no out-of-pocket cost to you, the students. The plan covers things, physician office visits. So this could be for something like a sore throat or you've developed a rash. It also includes mental health, both inpatient and outpatient. So it could be an office visit for, with a psychiatrist or psychotherapist. Those services are also covered. There is coverage for both inpatient hospital care as well as emergency hospital care. There is also benefits to cover prescription drugs while you're outside of the US. This benefit is a pay and claim benefit, and what that means is that internationally, there's not a network of pharmacies that works with insurance. So when you're abroad and if you're written a script for medication, you would go to a local pharmacy wherever you are studying or maybe traveling to a different country, and you would fill it there, and then you would take the receipt and submit a claim back to GeoBlue for reimbursement. There are some countries and some facilities that we work with who may have an on-site pharmacy, and if they do, they're willing to include that cost in your visit and bill to GeoBlue directly, but that is not normally the case all the time. The medical maximum on the plan is $250,000, as well as there's additional benefits here. So the repatriation of mortal remains is on the plan in the event that there is a death abroad. The plan will cover to return those remains back to one's home country. There's also a medical evacuation benefit of $250,000, which is kind of two different scenarios. So that covers someone if they are injured, say there's a type of car accident or some type of injury, and the location you're in cannot treat that appropriately. Our team, as well as the local team there, will make a plan to transport that individual to a better country, higher level of care. And we will cover that under the medical evacuation benefit. The other situation or scenario would be if in the event that there is an accident or maybe a serious illness and a student cannot continue the program, then both our medical team as well as the local medical team will discuss to determine if that student should just return home. In most cases, it would be the United States, and then we would make those arrangements for the student to return. Those type of situations fall under that medical evacuation benefit. Another assistance benefit that is on here is the bedside visit, and that is to allow for a family member or another individual to fly to be by one's bedside should they be hospitalized. So the covered student would need to be hospitalized for at least 3 days for that benefit to take effect, and then the plan will cover round-trip airfare and hotel stay for that chosen individual. The plan does not have any exclusions for pre-existing conditions. So if you are already on medications, you're taking a maintenance medication, there is no exclusions to cover those conditions while on the GeoBlue plan. And as mentioned earlier, there's also the addition of the Global TeleMD and Global Wellness Assist, which are our telehealth vendors, and we're going to go into those in more detail a little bit later. A brief overview here in regards to COVID. As we know, this question comes up quite often. So this just highlights what is covered under the plan and what is not covered. So the plan will cover medically prescribed testing and medically necessary treatment for COVID while abroad. And it'll cover if in the event an evacuation is needed, it will cover that as well. It will not cover one of the most commonly asked questions we do get is in regards to traveling and the need to show a negative COVID test. The plan will not cover any type of test that is needed to enter a country. There is also no there's no coverage for expenses for lodging due to quarantine or isolation in the event that there is a positive test and someone is required to follow that protocol. There's also on this slide, there's more information that we share, as well as we have a website that covers all of these FAQs as well that you would be able to visit and get more information if needed.
Okay, thanks, Alyssa. I'm going to go over the mobile app now, everyone. So the mobile app is a really great tool. It's good to download it as soon as you get the enrollment email. The app basically gives you access to all of the services with GeoBlue. Not only is it where you get your ID card and how you can submit, claims, but it's also where you could look up like medical terms, translations, news and safety information, and get some resources and documents. One of the really cool tools on the app is the medicine equivalent tool. So if you are taking a medication, and you need to know what it's called abroad, or if a doctor prescribes you a medication and you want to know what it's called in the US or your home country, you can use that tool to figure it out. You can also use it if you go to a third country when you're on your program and you get sick and prescribed a medicine and you need to refill it later. You can look it up that way as well. That's a really cool tool. So this is the welcome email that you're going to get upon enrollment by your campus. It's going to come from customer service at geo-blue.com. So if you don't see the email once you're enrolled, try looking in your spam for that email address. And then it basically gives you the information that you need to register. This certificate number here will be in your email address or in your welcome email, and that is your insurance ID. So registering on the app is really easy. You could also choose to register on the website if you prefer, but I think most of us have our phones and the app, in the palm of our hand almost all the time. So the app is really easy. So you go and you download it from either Apple or Android, and then you hit this register button here. That will open up a website where you put in your certificate number and it takes you to the correct place. Now, the thing to remember on this is that all of these fields should match exactly what is in your welcome email. If you are having trouble registering for whatever reason, one of the most common mistakes is that the date of birth gets transposed. So instead of month, day, it gets to day, month. Or if you have a longer first or last name that's maybe hyphenated, sometimes you might need to, how you're enrolled is going to determine, where the hyphenation should be, etc. But if you have any questions, you can always reach out to our customer service team, and they can help you figure out the right combination to get it to work. All right, so accessing Global TeleMD. Alyssa, you want to take this one?
Yep. So this is the telemedicine service that GeoBlue has now added to the program. So Global TeleMD is a telemedicine service. So mainly what you're going to be using this for is kind of those things I was mentioning earlier. So if you have a sore throat, or you've developed a rash, or you have some other symptoms that you're not sure if, they need to be seen by a doctor. So instead of, trying to schedule an appointment with, well, first finding a doctor locally where you're at, scheduling an appointment with them, and then going to the appointment to be seen, you're able to use this service and do everything remotely. So Global TeleMD provides the option to either do a phone call just with a provider, or you have the option to choose a video consultation as well. The doctor that you will be, kind of matched up with will be based on your location. So if you're in Germany, they're going to have a doctor that's licensed in Germany to, talk with you, discuss your symptoms, and be able to triage whatever may be occurring. So the next few slides that we're going to review is kind of the steps in the process on how you're going to access this feature. It is a separate app from GeoBlue, but you are able to access it through the GeoBlue app. That would be the easiest way to get the app. So the first screen here we're looking at is when you're in the GeoBlue app and you've registered and you've logged in. The first screen is what you're going to see. You're going to see this like a welcome email or welcome screen, and there's going to be a banner at the top with the different icons. You're going to select the telehealth icon, and then it's going to bring you to the next screen, and it's going to have two options. It's going to ask talk to a doctor or talk to a counselor. For Global TeleMD, you're going to want to choose the doctor option. Once you choose talk to a doctor, then it's going to take you to the App Store. So this screen is showing what it's going to look like in Android, so in the Google Play shopping area. And then you would hit the open or download option. This is the exact same steps and process about what it would look like on an iPhone. So same exact thing, you log into the GeoBlue app, you see the banner at the top with the icons, you're going to choose the telehealth. Once on telehealth, you're going to select the talk to a doctor, and then it's going to take you to the app in the App Store, and you're going to download the Global TeleMD app from there. Once downloaded, you are going to need to create a profile on Global TeleMD to access the service. So very similar to when you registered on GeoBlue, it's going to ask you for similar information. You're going to need to create a profile. So down at the bottom of that first screenshot, there's a create a profile button. And then you're going to fill in the basic information. So name, email address, date of birth, gender, language, country of residence. Once all that information is entered, then you also need to enter in the certificate number. So that is the certificate number that is sent in that registration email you get. That welcome email you get from GeoBlue has that number in it, and you're going to use that to enter in this field as well. Then you create a password based on the parameters that they have below, and your profile is set up. So once the profile is created, then you are able to request the service. So as I mentioned earlier, you have two options. So you can request a video consult or a phone consult. So I believe this is the phone option. So you would request a phone call, and then if for some reason you have other people enrolled with you, if you're taking dependents, probably not the case, they would also appear here, but you're going to select yourself, and then it's going to ask you if they can use the location services on your phone so that it can provide you the correct phone number to call. From here, you're going to be asked to enter a few more fields and information. So it's going to ask you to provide what you want to be seen for today. So the reason for the appointment, you're also able to upload photos. So for example, if you have a rash and you want to show a picture of it, you can upload up to 5 photos in this area for the doctor to receive. Once you've submitted this, you'll get the callback confirmation for the doctor to then call you back. Here it says in less than 1 hour, approximately. So this is just how you would go about getting a video consultation. It's just slightly different, that you enter your appointment details, then it's going to provide the confirmation that it's been booked, and then you would launch that video consult from the app, and you have the ability to do that up to 5 minutes before the scheduled time or call. So as you can see on the last screenshot, in the app, you would hit the start the video call button, and it's going to open up, a video showing you and then the provider on the other end. Here's the example. Once the appointment has concluded, there are several options that the provider can do. So, for example, if you need medication, so if the rash you have needs an ointment, they can write a script that's sent to you, and then you can fill that at a local pharmacy. That is based on local regulations, so it would depend on where you're located if they have the ability to write a script. So you would just need to confirm and ask that question when you're in the consult. The doctors also have the ability to provide sick notes. So for example, if you are ill and you can't make it to class and your class that you're missing requires a sick note, you can request the provider to give that, and they will upload that to your profile in the app once the session has concluded.
Okay, thanks, Alyssa. So now I'm going to go over what we call Global Wellness Assist, and this is basically an EAP, and it's our solution for remote counseling services. So the Global Wellness Assist is basically an international assistance program for students, colleges, universities. It's free, it's confidential, and you can access it 24/7. No one at your school will know that you've used the service. No one, your parents will never know. Nobody but you and the provider know if you need to access the service. They can help with all sorts of things, not just necessarily, counseling for homesickness, but they can help you with, bullying, harassment, managing academic and personal life, which I know could be kind of hard when you're living in a different country. You get 6 counseling sessions per condition per year. So, you get 6 consultations for, say, homesickness, 6 consultations for anxiety, so forth. You can choose to do these in person if you prefer, but I will tell you it's really hard to get appointments in person. And you guys have probably seen this both inside the US and maybe you've heard outside the US, but it's really difficult to get appointments with doctors now due to COVID and scheduling concerns. So I want you guys to keep this in the back of your head so that remember that if you need it, it is there for you. So similar to accessing Global TeleMD, you also access this from the telehealth button right here on the GeoBlue app. But instead of hitting talk to a doctor, you're going to go to talk to a counselor. And this number is going to pre-populate based on where you are. So just like with the Global TeleMD app, it's going to be important that you allow the GeoBlue app to have access to your location so that it gives you the appropriate phone number to call. It's really hard to call a toll-free number outside of the US. It's basically impossible. So you just want to make sure that, in Germany, you get the German toll-free number, or in the UK toll-free number to call. So I know if you're like me, you probably don't want to turn on location services, but in this case, I would highly recommend doing so. Here's just a couple more screenshots that show the process about allowing location services. You can choose only to allow it if you are while you're using the app, so it's not always running in the background. The GeoBlue student website also has access to the EAP. So if you're a web user and not a phone user, you can go to the website and go to Tools and Services and Wellness, and that will take you over to the Wellness portal. The good thing about the Wellness portal on the website is that there's also a lot of online seminars and other resources that you can use, and you can also contact a counselor through the website by clicking this button. I will say that the best way to reach a counselor is to call them instead of emailing or some other form of communication. Okay, now Alyssa's going to take over and show you how the GeoBlue network works.
Thanks, Allison. And one more thing I wanted to add on the telehealth services. Both of those, Global TeleMD and Global Wellness Assist, are free of charge. So there's going to be no out-of-pocket cost to you, the insured student, to use those services. The only time there may be a cost is in the event that you are prescribed a prescription and you would have to go fill that at a pharmacy.
Excellent point, Alyssa.
All right, so next we're just going to go over how you would access in-person care. And this is going to be done all through the GeoBlue app or website. As Allison said, you have access to both. It's just more likely that you'll be using the app. So in the app, you would first, it's kind of hard to see, but on the first picture, there's a current location area. And this is where you would set your current location, so where you're at locally. Right now, this is set on Berlin, Germany for that screenshot. And then you're going to choose the Find a Provider. And then once you choose that, you're going to have 2 options here. It's going to say US provider or the non-US. When you're outside the United States, you would be using the non-US provider finder. Once you select that, you're going to have 3 more options here. It's going to ask doctor, hospital, or pharmacy. The doctors that, if you select this, these are all doctors that are individually contracted with GeoBlue. Hospitals, this is going to be all types of clinics, hospitals where there's emergency rooms, facilities like that. So once you select the doctor, then you're also going to have the ability to select a specialty. Most times for, sicknesses and illnesses, you would be seeing an adult primary care doctor. If you do have a chronic condition or you're on maintenance medications and you know the type of doctor that you normally see in the US, you would be able to search for that specialty if available. Once you select the specialty, then the app is going to show you a list of doctors in your area. As you can see from this screenshot, it is a little small, but any provider or hospital that has the network provider next to it, that indicates that that provider or hospital is directly contracted with GeoBlue. In the event that you go there to be seen, they will submit bills directly to GeoBlue for payment once a guarantee of payment letter has been requested and sent. So we will go over that in I think those are the next few slides.
Oh, and one other thing on the hospital selection, you want to make sure that you're looking for a network provider on the hospital. There are hospitals that might not be network provider, but we include those because in a lot of places, the emergency rooms are at the large public hospitals, and the large public hospitals are not usually able legally to sign a contract with a private insurance company. So if you do end up at a non-contracted either doctor or hospital, you might still be able to get direct billing, but you'd have to call the team, our Global Health and Safety team, and let them know those details. Okay?
So here are a few screenshots of additional tools in the app that you have access to. So the first picture is the claims area. So this is in the event Allison explained you had to pay for a doctor visit out of pocket. You can submit a claim to GeoBlue directly in the app via the eClaim service. So you would just choose new eClaim. It's going to ask you a whole bunch of information. So basically, the claim form that you would normally fill in a paper version, you're going to just enter the information into the app. Then you're going to upload a picture of the invoice from the provider, as well as a payment receipt or slip showing that you paid for the service. And then you're able to submit that documentation through the app, and it comes directly to GeoBlue for processing and reimbursement. It's important to note that claims that are submitted when reimbursed, we've reimbursed via USD check to the mailing address on file. So for study abroad students, it's normally best to have your US address on file because if you have a foreign address and you're only away for a short amount of time, until you submit the claim and then we send it back to you, you're likely returning from your trip or time abroad. The next picture is the medicine equivalent tool that Allison touched on earlier, where you can enter where you're at to where you're going and search for what medicines would be called in that country. If you don't find your medication in that list, it's best to reach out to our Global Health and Safety team and ask them to research further. So the list is updated and maintained, but it doesn't include all and any medications that are out there. So if you're not able to find it in the list, then reach out to our team and they can assist you further. And the last slide shows the electronic ID card. This is really important because you can access this immediately when you're at the doctor. So if they ask to see a copy of your ID card, you can pull it up right into your app and show them. This is just a high-level overview of what the website looks like. So if you would log into the website versus the app, this is the view that you would see. This is called the Member Hub, and this is the main screen that it will take you to. You have all the same services and features that you have in the app, and you can access them here. As you can see, you can print ID card, you can view your claims. There's the International Provider Finder, as well as those tools that we went over briefly.
So if you would like to give your parents access to the GeoBlue website, students, this is up to you. We do have a parent or guardian website, geobluestudents.com, and then click parent. What this will give your parents is access to the available doctors, the available hospitals, and the security and news profiles. Your parents will never have access to any of your personal information. They will never see any of your claims information. That's all protected by HIPAA. And they won't see that. They'll just be able to see the doctor search and the security/news profiles. If parents are going to log in, they will just need to know the student's certificate number, first name and last name, and then they can create their own profile. All right, so Global Health and Safety Services. So Global Health and Safety is a team that, coincidentally, Alyssa and I both started off in working at GeoBlue, and that's basically the assistance hub of GeoBlue. So when you're abroad and you need help, these are the people who will be working with you at GeoBlue. So they can help you before you go with pre-trip planning for chronic conditions. So like Alyssa said, if you're taking a medication, maybe you have Crohn's disease and need to arrange Remicade treatments, or maybe you just want to know if your inhaler is available, things like that, they can help you do that. And then while you're away, they will monitor your medical condition. If you're in the hospital, we'll keep an eye on you, make sure that you're getting the appropriate care. And if you need to be evacuated, we'll take care of that as well. And then that team would also handle the evacuations, the bedside visit benefit, and the RMR benefits if you would ever need them. Hopefully not. So just a little bit about pre-trip planning. The one thing that I always want to remind people is that just because a drug is legal in the US does not mean that it's going to be legal where you are. So big hitters on this one are any type of amphetamine-based medication like Adderall. That's generally a no-go anywhere except the US. So if you are taking Adderall, you may want to speak with your treating physician about moving to a medication that's like a methylphenidate base, like Concerta or Ritalin or something like that, because those are generally more available outside the US. But if you are taking a medication, I would really recommend that you go on the app and see if that medication is available. You could also contact our Global Health and Safety team if you don't have access to the app, and they can tell you if that's available or not in country. But I can tell you, anyone taking Adderall, start talking to your doctor now, because you're really not going to be able to get it outside the US. So what to do in the event of emergency? Go to the nearest emergency room and contact us from there. Okay, don't worry about the insurance. We'll take care of that when you're out of immediate crisis. Anyone can open a case. If your parent or one of your traveling buddies or your advisor, anyone can open a case. Your job is to get to the nearest emergency room. Okay. Then you want to give us a call at this number and open a case. If you do need to be medically evacuated, or you find yourself in a situation where that might happen, you're definitely going to want to give us a call so we can start working on that sooner rather than later. And remember that piece that I said a little bit earlier on about network providers and non-network providers in emergency rooms? Well, if you end up in an emergency room, it's very likely not going to be a contracted provider. But don't worry, it's very unlikely that you're going to have to pay for your entire hospital stay out of pocket. Okay, so just give us a call. And 99.9% of the time, if you're admitted to a hospital, because your plan covers everything at 100%, the facility will gladly bill GeoBlue directly once we issue that guarantee of payment. And the guarantee of payment is basically just a letter from GeoBlue verifying that you have insurance coverage, and we will pay the bill. Okay? All right, Alyssa's going to go over HIPAA.
And these are the last few slides. So we just wanted to touch on HIPAA briefly so that you had a general understanding. So as Allison mentioned, anyone can open a case with our assistance team should you require it. So you can do it yourself, or a local staff member or advisor, a parent, a friend that may be with you can open that case with GeoBlue and provide that information to us. However, once that case has been opened, our team legally cannot provide any type of information back should we not have a signed HIPAA form on file. So as you can see here, if the case was initiated by someone other than the insured participant, we can provide the number. So if there's a case number that's assigned, we can provide, simple status as to if that person is still hospitalized or discharged, as well as the status of the guarantee of payment letter that we've been mentioning, which is in regards to billing. If they haven't initiated the case, then the only information that our team is able to provide is really just the case number, as well as a possible status if that patient it's an inpatient case. And the reason for this is that our team needs a signed HIPAA consent on file to release information to other parties. Allison, you want to go to the next slide? So there is a there is a HIPAA form that GeoBlue has available, and we would recommend that it's completed prior to departure and sent to us, and then it's uploaded to your personal account at your ID level. In the event that we don't have one and a case is open for a complex or inpatient case, one of the first steps that our team will take is we will send an email to the student if they're able to sign via DocuSign, so that we can get that set up from the start of the case, so that communications can be much more easy in between with parents and the school.
Yeah, so this is really important, guys. HIPAA, it's, you don't want to be doing this in the middle of a crisis, so I would really recommend going online and downloading that HIPAA form and filling it out prior to leaving. At least put your parent or someone on there just in case something happens. We aren't going to proactively reach out to your parent and provide them information, but if you are hospitalized and you need us to do it, if it's ready beforehand, it's a whole lot easier. Okay, and that concludes our presentation today.